Can I get a mic check from the podium?
Either 1, 2, 3, 4, 5.
Thank you. To our reporters on the line, please press 1 to ask a question. If you are called on and have a follow-up, please press 5 during the answer or immediately after. Again, if you are called on and have a follow-up, please press 5 during the answer or immediately after. Thank you.
Good afternoon. This is the 2-minute warning. Please press 1 to ask a question.
Well, good afternoon, everybody, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have 317,495 cases, 3,288 new cases reported since yesterday, 1,501 people in the hospital, and sadly, 4,852 people who've died. As North Carolina families wrestle with the sickness and death caused by this virus, we keep them in our prayers and send strength their way. North Carolina's COVID-19 numbers remain too high. Our percent positive has crept back up to around 8%. The weekend saw our highest day of reported cases, and today we have the highest rate of hospitalizations since the pandemic began. These are numbers we cannot ignore. But other states have been even worse right now, and they should be the canary in the coal mine for us. Last week, we took action to lower our indoor gathering limit to 10 people because we know this virus spreads more easily indoors. Capacity limits remain in place for retail stores, restaurants, entertainment venues, and other businesses. We continue to tell people to wear masks and stay distant and stress enforcement of those critical rules. Today, we're introducing a county alert system to identify North Carolina counties with the highest levels of community spread and offer specific recommendations for how working together with us can bring down their numbers. Counties of concern are designated as red, orange, or yellow, using a combination of three specific metrics that Dr. Mandy Cohen, our Secretary of the North Carolina Department of Health and Human Services, will detail in just a minute. These are from the same set of metrics that we use every week to give an update on how North Carolina is doing with COVID-19. This system will help our counties make decisions about what more can be done to slow the spread of the virus. The system also includes additional recommendations for individuals, businesses, community organizations, and public officials on actions that they should take. Simply put, this new county alert system shows our state's viral hotspots. But let me be clear, the entire state is experiencing widespread transmission. Cases across the country are surging right now, overwhelming some hospitals, forcing states to go backward with their COVID-19 restrictions. Right now, North Carolina's metrics are increasing, not surging, but a surge can happen quickly. If officials, business, community, and faith leaders, and people who live in these orange and red counties can work with us to take effective action to bring down their numbers, we can protect our state's hospital system and save lives. And it can prevent us from having to take significant steps backward. I'd like to ask Dr. Cohen to present more detail on how the state developed this map and what we're recommending to these counties. Dr. Cohen?
Thank you, Governor. I am concerned about where we are as a state. Today, we once again surpassed 3,000 new cases in one day, and our percent of tests that are positive continues to climb. While our hospitals have capacity, they're feeling the strain, particularly in the Triad area. Even accounting for the federal change in how hospitalizations are reported, we are seeing more people needing hospital care than ever before. As you noted, Governor, COVID-19 trends in many parts of the country are even worse. More and more states are tightening restrictions, not allowing people to gather indoors with anyone outside of their household, closing indoor dining, asking residents to stay home except for essential trips, and more. Here in North Carolina, we hope to avoid having to take such actions. The COVID-19 County Alert System that we're introducing today is one tool to help us slow the spread of the virus right now. Today, I'll walk you through the details. All North Carolina counties are experiencing high levels of community transmission of COVID-19, but the virus is impacting some counties even harder. You can see this already on our dashboard right now, which shares county-level data for cases, percent of tests that are positive, deaths, and other metrics. This new COVID-19 county alert system makes this data more visible, more understandable, so North Carolinians can easily see how their county is doing. And it provides a list of actions, again, that individuals, businesses, community organizations, and public officials can take to slow the spread in their county. So let's take a look at the metrics behind the county alert system. Because no one metric provides a complete picture, we use a combination of 3 metrics to categorize counties. The metrics are informed by the White House Coronavirus Task Force and North Carolina's key metrics that you're familiar with. The first metric is case rate. Here, it is adjusted for population in the county, so we can compare counties with different sized populations. The metric is the number of new cases in 14 days per 100,000 people. This is the same measure that the White House Coronavirus Task Force uses to compare counties and states. The second metric is the percent of tests that are positive, and everyone's familiar with that one. The third metric is a hospital impact metric, and this is a composite score based on the percent of hospitalizations that are for COVID-related visits to the emergency department, the number of staffed and open hospital beds, and critical staffing shortages over 14 days. I want to thank our hospital partners who worked with us to determine how to best measure the impact of this pandemic on hospitals at the county level. So we use a combination of these 3 metrics that I just went through to categorize counties into 3 color tiers to describe their level of viral spread and healthcare capacity impact. Red is critical, orange is substantial, and yellow is significant. On this slide, we show the cut points on those metrics we utilize to categorize counties into their color tier. Every county in the state is experiencing community spread, and so to move from yellow to red or orange, 2 things have to happen. First, the county has to meet the criteria for its case rate, meaning more than 100 cases per 100,000 for orange, more than 200 cases per 100,000 for red. Second, the county has to also meet at least one of the following criteria: either an elevated percent of tests that are positive or an elevated hospital impact. For example, if your county crosses the case rate threshold, and in the left-hand column, and its percent of tests that are positive is between 8 and 10%, or the hospital impact score is moderate, your county will be orange. As we move to the next slide, you can see a map of the state showing which counties meet the criteria for red and orange. We have 10 counties that are red with critical community spread, and 43 counties are orange with substantial community spread. And the remaining are yellow with significant community spread. No matter the color of your county, there are critical actions we can all take to slow the spread, starting with everyone wearing a mask whenever you're leaving your home. But it doesn't stop there. Everyone has a responsibility, each North Carolinian, each business, each public official in each county. Red and orange counties need to do even more to slow the spread of COVID-19 in their communities. And in the next few slides, I'm going to highlight some examples of the recommendations for the red and orange counties that go further and build on top of the already existing executive orders and guidance from the Department of Health and Human Services. So if you live in a red or orange county, you can help slow the spread and protect your loved ones by limiting social activities with other households and minimizing the number of people in your social circles. Reduce your public interactions to mainly essential activities and avoid settings where people congregate. For businesses and community organizations in red and orange counties, they should be using telework wherever possible, canceling non-essential work travel, participating in the Count on Me NC training, and avoiding all indoor meetings or events or gatherings above 10 people. Public officials can expand free state-funded testing events. They can increase the availability of non-congregate housing so people who need it can have a place to isolate or quarantine. They can increase enforcement of gathering limits and masks. And they can also adopt local ordinances with civil penalties. A full list of recommendations for all of us and the additional actions for red and orange counties is included in today's alert. The state can also provide additional support. Counties are not on their own. We can help with sharing messages about prevention. We can work together on enforcement. We can ramp up testing together, support our local health departments, and allow support services so people can afford to stay home to isolate or quarantine. The COVID-19 County Alert System is now posted on our website. Moving forward, we will publish this report monthly. Counties that are identified as meeting the criteria for red or orange tiers will stay in those tiers for at least 4 weeks to give them time to make progress. Today, I covered a lot of ground, but the bottom line is that the COVID-19 County Alert System gives North Carolinians an easy way to see how their county is doing and to know what they can do to protect their family, their neighbors, and slow the spread of this virus. With promising news on the vaccine front, we need to do what we've done throughout this pandemic: work together to avoid the threatening situations that many other states are facing right now. I know we can do this because time and again, since our first case in March, North Carolinians have done exactly that. Thank you, Governor.
Thanks a lot, Dr. Cohen, and thanks to your team that helped to develop this system. By pinpointing counties with high virus transmission and asking everyone in those counties to work with us and do more right now to slow the spread of the virus, we can succeed. It can help bring down their case rates, keep their communities safer, save lives, and keep their hospital systems working. Right now, these are strong recommendations. However, if our metrics keep moving in the wrong direction, the state could impose additional orders, either at the local or statewide level. As numbers worsen here and across the country, we need North Carolinians to treat this virus like the deadly threat that it still is. I know that months and months of acting carefully have made people tired, and the caution and care of the early days of this pandemic have given way to more relaxed behavior. But we cannot let weariness win. With 2 vaccines on the horizon with more promise than health officials ever imagined, North Carolinians have more reason than ever to be hopeful. That hope must drive our efforts to bridge the gap and slow the spread of this virus until vaccines help us to snuff it out. Letting the virus win now, with vaccines coming so soon, is like punting at the 10-yard line. That's foolish. We need to reach this goal line together. Now is not the time to give up and to let more people get sick and die. Now is the time to recommit to taking this virus seriously. And that means changing our holiday plans to be smaller and safer. So let's stick with what we know works. Wear a mask, wash your hands, wait 6 feet apart. Be smart about your Thanksgiving plans and get creative with the options to celebrate safely. Your community may benefit or suffer from your decisions. Remember, this pandemic won't last forever, but our strength and resilience will. Also with me today is the Secretary of Public Safety, Eric Hooks, and our Emergency Management Director, Mike Sprayberry. Lee Williamson and Monica McGee are our sign language interpreters. And behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We're going to have media questions, and if you could identify yourself and your organization, we would appreciate it. And we'll have our first question.
Our first question is from Michael Hyland with CBS 17.
Michael, are you there? So we might want to go to the next one. We're not hearing a question.
Moving on to our next question from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn in the News and Observer. Looking quickly at the map and it being by county, are you going to leave this up to county health departments, county commissioners? Is it spun out within cities if there's the metrics are different for cities versus counties? And you mentioned that if things get worse, there would be a state mandate. Would that be a state mandate targeted at specific areas and counties?
So this metric system is a starting point for us. We wanted to identify counties, and it is at the county level where the metrics have been taken. We wanted to identify the counties that were having the worst problems, the viral hotspots. And this is for everybody. It's not just for county commissioners, but it's also for mayors and city councils of cities and towns within the counties. It's for the businesses that work there. It's for the business leaders. It's for the community and faith leaders and every person. There are recommendations for all of those groups in this county metric system. And what we want to do is to create a synergy of enforcing the requirements that we already have in place that are in executive orders, like mask requirements and gathering limits and percentage of occupancy, but also try to establish things that are unique to those counties that we think might help to slow the spread. And that means more state help and potentially more state resources to help counties wrestle this problem. And we wanted to do this as strong recommendations because we want to work in a cooperative way. And we have done better than other states have done because we have not seen surges that the other states have. But we know it's too high. We know it's continuing to creep upward, and we have to take strong steps now. So this is why we put this in place. And if we continue to see our numbers rise and we continue to see an increase in our percent positive and our metrics and our hospital system becomes too strained, then we will look at either statewide or local requirements that would be a part of an executive order or something that the Department of Health and Human Services would do in order to force more changes in these areas. I think, however, this is a good time for us to work together, reach out to each other, and to make progress. Would you want to add to that, Dr. Cohen? Next question, please.
We have a follow-up, Dawn Vaughn, News and Observer.
And thanks for the follow-up. And looking at the hospitalization rate too in these counties, is there a plan for if there's not room, if they would come to the areas with more hospital capacities, if the rural hospitals can accommodate, and with the vaccination rollout, is the state ready, and would they be targeted at these counties that are in the red and orange level?
Well, our vaccine rollout is going to be targeted first to frontline healthcare officials across the state. And remember that, yes, we have some red counties, and we particularly want to concentrate on them, but every county in our state has widespread virus. So we know that everywhere we've got to work on making sure our healthcare officials get vaccinated and our people who are in long-term care facilities. And you can look at our vaccination rollout plan to see how we are prioritizing things. We want to get this vaccine out as quickly as possible. But also with hospital capacity, what they've done, I think, is very helpful. And the department worked closely with the hospitals to determine a hospital capacity for each individual county. And some counties don't even have a hospital, but you look at the areas that the hospitals that serve the counties, and they were able to determine when to establish a metric when this gets strained. And I think that Dr. Cohen can talk with you about what the plan is in the event that the hospital capacity does get strained in these areas. And we know in our rural areas, we're very worried about that. And Dr. Cohen's team has been talking about the concern that we've had with rural transmission now for several weeks. But Dr. Cohen, I'll recognize you on this.
Hi, Dawn. A couple of things on the hospital impact metric. First, it recognizes that our hospitals are dealing with way more than just COVID. We recognize that they are serving many, many healthcare needs of our citizens across the state, and we wanted to acknowledge that impact. So we look at not just the COVID impact, but also overall the capacity of the hospital and the staffing for the hospital. And when we see a hospital start to get strained, we have really worked hard to make sure we're working collaboratively. It first starts with transparency, making sure we know when a hospital is reaching some of its more strained places. And so we have alerts to make sure we're understanding that. And then it's a matter of working together, because we can move patients around within a region. And so I think that good transparency and good collaboration across hospitals where they're helping each other out so no one hospital gets overwhelmed, I think is really going to help us. We also have additional resources that we can surge from the state level, but I think it is really that transparency and collaboration at the hospital level. And they've been doing a great job back since March in working together. And so we've really, I feel like we are well positioned as a state to certainly be aware of what is happening and do our best to manage our current capacity as well as surge beyond the current capacity that we know our hospitals have. It will be hard work, which is exactly why we're trying to raise the alert now to say we need to slow the spread of this virus, because we are already seeing some of our hospitals reach some strain. I was mentioning the triad area of the state where we are seeing hospitalizations accelerate a little bit faster than the rest of the state. So we want to be particularly attuned to the triad area. And I know folks are working hard. So we work with our hospitals every single day to make sure we're understanding that and to share resources across the state. Thanks.
Next question, please.
We'll try Michael Hyland with CBS 17.
Hi, I hope you can hear me this time. This is Michael Hyland from CBS 17. One of the questions I want to ask about this is last month you all had sent a letter out to various counties talking about potential steps they could take with increased enforcement. Several of them who talked to us said they were reluctant to do that at that time. How does this system change things, do you think, from last month, what you were asking counties to do? Do you think this would lead to any greater cooperation from them in terms of enforcing some of the existing mandates you put in place?
That's a great question. And I think it will lead to increased cooperation, because I think you can now see precisely what the problems are and the specific metrics that each county is experiencing as compared to other counties. And this should send a real alarm across the county, not just the public officials, but the business owners, the faith community, people who live there. And we're hoping that this open and transparent map with all of the information can raise the level of concern throughout each of these counties, make it more public facing, and help work with us in order to make sure they drive down the spread. And Dr. Cohen, I know you participated and talked with local officials as a result of the letter that we sent earlier, and you might have a comment on that.
Thank you, Governor. Yes, I think this is the next phase of our work with our local officials. And many of them have been doing very good work at the local level. I want to particularly commend all of our local health departments that have been working hard every single day to slow the spread of this virus and fight back. I also, there are a number of counties that have gone further. Even just recently, Halifax County passed a resolution talking about enforcement of the mask mandate. I think that is really positive movement forward. They are an orange county, Halifax is, so I think that was great anticipation of needing to go further and do more. And I hope other counties will take similar efforts to work on enforcement, but also to bring the community together. This isn't just about enforcement tools necessarily, but really how can we all raise awareness together, work together on this so that we don't have to go backwards as a county or a state. Thanks.
You mentioned Halifax County. I think the sheriff even said that he is going to begin enforcing the mask mandate there. So there are positive things that are happening at the local level. Next question, please.
Follow-up, Michael Hyland, CBS 17.
There are some states who have used similar color-coded systems like this at the county level in how they have implemented restrictions. For example, red counties could only open businesses at a certain capacity, and it would be different in orange or yellow counties. Is this the start of implementing something like that in North Carolina, or will the phased orders still be statewide in terms of what percent capacity businesses can have?
That's another good question, and I'm going to let Dr. Cohen address it. I will say that we have looked at other states and have studied what they are doing, and most states have larger counties than North Carolina. I think California has 52 or something like that, and you know how big it is, and we have 100 counties in our state. What we hope is that this level of cooperation, that with the existing requirements, statewide requirements that we already have, that we can begin curbing this increase we're seeing, and that we can begin to drive the numbers down. But if that does not happen, then we may have to do more either on a statewide level or at the local level in some way. That decision has not yet been made, but we're hoping that this effort can help us slow the spread. And Dr. Cohen, you may want to have she doesn't, she's good with that. Next question, please.
Our next question is from Derek Dellinger with Fox 46.
Thank you for taking my question. This is Derek Dellinger with Fox 46. There's a question right now that I think a lot of people are wondering right now. And there is a general expectation over the next little bit with the cases, as you mentioned, increasing, not surging. What is really the big thing that's keeping us from going back a phase right now? Because I think a lot of people are kind of expecting, at least if not in the next couple of days, the next couple of weeks, of something potentially changing. Is there anything that you can say to assuage those fears or to potentially validate them?
I'd say first that we've learned a lot since March about this virus, how it behaves. Secondly, we have a number of requirements in place, our mask mandate, our occupancy limits in public-facing businesses, and an effort to really try to get more compliance with the requirements that we already have in place can help us curb the spread. You know, if we're struggling getting compliance, just laying on more requirements may not have the desired effect, particularly with a population that's been going through this for almost 9 months now and is tired. But what we're trying to do is re-energize the people of our state to say, look, we've got vaccines coming that we know can help us substantially reduce the spread and to help get us back to normal. And they're coming soon. And let's bridge this gap here. Let's re-energize ourselves to say we've got to do the things that we need to do, even though they may be inconvenient, of wearing a mask and staying socially distant. It's really important for us to do so that we don't have to add on additional requirements. We will do what we need to do to protect the health and safety of North Carolinians. We think that this is the most effective approach at the moment. Dr. Cohen, do you want to add to that?
Hi, Derek. I want to reiterate that There is widespread viral transmission across our state. You'll notice that every single county has a color, whether that's yellow, orange, or red. So I want to make sure that folks are taking the precautions that they need to, no matter what county they live in. We have to focus on masks. We have to focus on keeping our gatherings under 10. I'm particularly worried as we head into Thanksgiving when we know folks want to gather together. And just as a reminder about Thanksgiving, if you are going to travel or get together, keep it small, keep it outside, wear masks all the time, and consider getting a test ahead of Thanksgiving. And for those who are looking to get a test, make sure to particularly seek out the state-funded free testing sites where you can go and not just get free testing, but you can, in some of the cases, sign up ahead of time for appointments. So keep it small, keep it outside, masks all the time, consider a test as we head into thinking about Thanksgiving. Thanks.
Next question, please.
Our next question is from Richard Craver with the Winston-Salem Journal.
Yes, Governor, this is Richard Craver with the Winston-Salem Journal. I had a couple of questions. One, I know that you had hoped around the end of the election that you would start seeing a lessening of the politicizing of COVID. And I was wanting to see if y'all have seen that in the last couple of weeks, particularly as you were implementing these changes and advising the counties and communities about the alerts and things like that. And then for Secretary Cohen, I was going to ask, you mentioned the triad in particular about hospitalizations. Is that more of an issue with the smaller community hospitals? Because the triad in this instance is 17 counties compared to the Wake Forest Baptist, the Navant, the Cone Health hospitals.
I was on the White House coronavirus task force call yesterday with Vice President Pence and the entire task force with, I think, almost all, if not all, of the governors of the United States on the phone. And there was mutual excitement about these two vaccines with the potential of a 90% success rate. And Dr. Cohen can talk to you about the significance of that. And obviously there's more data to review, but all of us from all of the states and the entire task force were very excited about that news. And I do believe that now that we're past the election, that we can work on coming together to fight this virus. And can get it out of the political sphere. The science and the data and the recommendations are very clear as to how we can slow this spread. And the sooner we can get together on this, the better off that we are. And I'll let Dr. Cohen address the second question.
Hi, Richard. In terms of strain that we're seeing in the triad, so we're just seeing hospitalizations accelerate a little bit faster in the triad area than we are in the rest of the state. And it is in some of our smaller hospitals. I'd say it's the western part of the triad. And if you look at our county alert today, it is reflected on that map. You will see a number of orange and a couple of red counties in the triad area. It's more in the west, starting to get into the Appalachia area and some of those smaller hospitals in particular. Again, no urgent concerns about capacity, but again, starting to feel the strain, and we want to raise that level of concern now so that folks can take actions that they need to do, because we don't want to see any part of our state be overstretched in their capacity to be able to serve folks in our hospital system. So I think this is the map that we really want folks to be paying attention to what's happening in their counties, take the actions that they can do individually, that they could do as business leaders. And if we can do that and work together, then we won't have to go backwards in order to protect the capacity in our healthcare system. Thanks.
Next question, please.
Our next question is from Marissa Tansino with WFMY.
Hi, Governor. This is Marissa Tansino with News 2 in Greensboro. My first question is, with numbers increasing, more people expected to go get tested, approaching the holiday season, is the state doing to make sure everyone still has adequate access to being tested, making sure we don't run out of tests for people, and quick turnaround time for results?
So we have our free testing sites throughout the state. You can go to the Department of Health and Human Services website. You can go there. My understanding is they're not long lines, they're not long wait times. It's some of the sites, but not all of them. You can even sign up for times, and the cost is free. With people who have private insurance who go to either their doctors or their clinics or to pharmacies, it's a little more that you have to go through in order to be able to get a test. It's not that difficult, but you have to maybe pass some of the requirements for getting a test that they may have. So we're telling people, particularly if you want to get screened to go home for Thanksgiving, that you can go to one of these public places that are on that website throughout the state to be able to get a free test. In addition, we have provided tests to our universities. A lot of college students are beginning to go home for the holidays, and encouraging them to get tested before they go home. And I'm going to let Dr. Cohen talk a little bit more about our testing.
Sure, just a little bit more on testing. Also on our dashboard, you can see every day we post turnaround times for tests. And so far, we've been holding steady, even as we are doing some of the highest amount of testing that we've done since this pandemic started. We're seeing some days on our highest days of testing, we're doing upwards of 45,000, 46,000 tests in a day. And you can see those turnaround times have continued to hold, around 36 to 48 hours for turnarounds for tests, which is very good. We've also been using some of the rapid tests that we have shared with our local health departments. So those are tests that come back in 15 minutes. So I think we are supplementing different kinds of tests out there to make sure that folks have access to testing as we get into Thanksgiving. We are putting up additional free testing sites across the state as we head into Thanksgiving, anticipating that folks may want to get a test. So again, when you go to our website, you want to go to the free community testing sites. Those are the ones that are funded by the state, will be available for Thanksgiving testing. If you go to a place like CVS or Walgreens, often they ask you some series of screening questions. And one of those questions that you could check off and says that the public health official of your state or local area told you to get a test. So you can check off the box that says your local health official said, I should get a test ahead of Thanksgiving. So that is just slightly different than we've done testing in the past. So depending on the location in which you get your test, you may have to check off different things, but I think the easiest and free thing to do is to go to our community-based testing sites that are across the state. Thanks.
Next question, please.
Our next question is from Catherine Hussey with WCTI.
Hi, Governor. Yeah, Kate Hussey with WCTI. My question is, you mentioned some further restrictions if some of those counties don't lower their numbers. My question is it possible we might see travel restrictions to certain counties if their numbers only start increasing and not decreasing?
Well, first, we want to work with these counties to see if we can lower the spreads with the recommendations that we have in place now. And right now, those recommendations don't include travel restrictions, but I'll let Dr. Cohen address that issue.
Thanks for that question. We have certainly recommended canceling any non-essential travel, particularly for our businesses. So that is one of our recommendations in the red and orange counties, to really back off of non-essential travel. And again, as you're thinking about Thanksgiving plans, and if you are anticipating either traveling or getting together, a couple of key tips. Keep that Thanksgiving small. Make sure that you're outside. Wear masks all the time, and consider that test. Thank you.
Next question.
Our next question is from Cole Del Charco with WUNC.
Hi, Governor. Thank you for taking my question. This is Cole Del Charco with WUNC. Going forward, should North Carolinians expect that we'll be getting updates about easing or tightening restrictions on a monthly basis now that you've announced this new monthly report?
So that's a good question. This monthly report is to let the counties know where they are in their metrics. And we're going to come every 4 weeks to give counties the opportunity, hopefully, to improve and to show the progress that they have made. We usually look at, when we have issued an order, it's been within 3 to 5 weeks. And we're looking at the overall metrics and making a determination of how long the order will be. So the order may not be synchronized with the maps that we're putting out, but the next order that we have, I think, expires on December the 4th, which is the Friday after Thanksgiving. And we would likely to be making some announcements during the first part of that week to let people know what decisions that we've made. Got anything to add to that? Next question, please.
You have a follow-up, Cole Del Charco, WUNC.
Thank you. How would a month-long alert level affect school operations? Would, say, a county in a red zone be able to have in-person school after a month of being in that designation?
So we want counties, and we've urged this all along as they've made decisions about the school openings, whether they're going to do only remote, whether they're going to do part in-person and part remote, whether they're going to let grades K through 5 go full time. We've asked them to look at their local metrics. So this can help guide their decision, but there is nothing linking their decision to this map or any requirement that they do a particular thing using this map at this time. Dr. Cohen, would you want? Okay. Next question, please.
Our next question is from Dewan Hogard with ABC 11.
Hi, Dewan Hogard here, ABC 11. Thanks for taking my question. Governor, just with the new color coding, you mentioned earlier that these would be recommendations, but with the numbers not going in the direction that you would like them to be, why not have this be a requirement or a mandate?
Well, as we mentioned earlier, there's a lot of weariness about COVID-19, and people are beginning to get relaxed and are not sticking to the mask mandate and to the mass gathering mandates. And we think that a renewed effort here to focus on enforcement, to focus on what is already in the law with occupancy limits, with mask wearing, with gatherings, trying to make sure we lift this up and then implement other strategies that are in this metric system. We believe that that's going to work better right now to try to curb the numbers than just simply adding another layer. But if we continue to see the numbers increase, we may have to do a combination of both of these things. So this is a good point today to renew our efforts to make sure that we're enforcing what we have out there and to get more community buy-in. And I think this map showing our viral hotspots and putting an emphasis on those red and orange counties about additional things they need to do is the best way for us to proceed. Next question.
Follow-up, Dewan Hogard, ABC 11.
I thank you, Governor, for that. And as you take a look at some of your counties that are in red, or even a few that are in orange, that are close to even moving to red, is there anything that those counties specifically tell you? Are you able to pinpoint, and can you identify with us where those hotspots are, those viral hotspots are in those counties?
Dr. Cohen, I'll let you take that.
Hi, Dewan. There are a number of reasons, and each county may be different in terms of what is driving their viral spread. And I think this is a great opportunity for folks to come together as a local community to understand their numbers, to work with their local health departments, and importantly, have a consultation with the state. We'd love to dig in with you and figure out how and what strategies to map to what's going on in that county. We're certainly seeing viral spread in informal social gatherings. We've said that a lot in the last number of weeks. We continue to see it. And so we are really concerned, particularly as we go into Thanksgiving, about further viral spread in informal gatherings. We're also seeing increases in clusters in our religious settings. Again, it's where places where people gather without masks that is really seeing viral spread. But again, every local community is going to have different drivers, and we want to work with folks to tailor interventions that make sense. Some are a college town, others aren't. And so figuring out what might make sense for them as they go forward, we'd be happy to work with them and the local health departments to tailor those solutions. Thanks.
Next question, please.
Our final question today will be from Micah Henry with the Taylorsville Times.
Hi, Governor. This is Micah Henry with the Taylorsville Times. I have a question regarding the COVID positive cases that come from inmates in the correctional institutions. For instance, last Monday, Alexander County Health Department reported that 134 people were in quarantine with COVID-19, and approximately 60, that included approximately 60 inmates at the Alexander Correctional Institution, which is a DPS facility. Is there any methodology to separate those from the general population, since that's a sequestered population in the new county alert system scheme?
First, our thoughts and prayers and our efforts are with you all in Alexander County as you've dealt with this tragic flooding that has occurred and the loss of life there. And I know that in the middle of a pandemic, that is a very difficult situation that you all are dealing with. We hope that with this new county metric system, county alert system, that it can pull communities together along with the state and Department of Public Safety, things that we can do to slow the spread of the virus in the county. We are always concerned about people who are in congregate living. That includes correctional centers. And part of the effort to quarantine is people who potentially may have been exposed is to separate them from the rest of the population. But I think I'll let Secretary Hooks come forward, our Secretary of the Department of Public Safety, to address the issue of what's happening with COVID and in the prisons.
Thank you, Governor, and thank you for the question. We are able to dig into the data a little bit deeper so that we know what is in a particular state facility versus what may be in some of the larger metrics that may come out from DHHS. We are well partnered with them to abate COVID-19 in all of our facilities as well. One of the things that we do certainly take note of is that individuals who often live in those counties work in those same facilities. And so it may be a reflection of some of the officers and people that work in that particular correctional facility that may drive it, but they also live in that county as well.
And Dr. Cohen wants to add something to this.
Hi, Micah. In response to your question, we do notate when we do put out our metrics per county, if a county has more than 25% of their cases from a congregate living setting, we say that there may be different kinds of strategies that we would want to employ. So if Alexander County, and I haven't looked at their specific data, but if they have more than 25% of their cases that are coming from the correctional facility as a percent of their total, we would want to work with the county on some some targeted strategies as we go forward here. But I think Secretary Hooks is exactly right. And we have to remember the virus gets into these facilities, whether that's a nursing home or a prison, from the community, and then that virus then returns to the community from those settings. And so it's really important that we did include those in our metrics as we calculated where did a county fall in terms of red, orange, and yellow. There may be different strategies we want to employ depending on if you have a larger outbreak in a congregate living setting. But I think it's an important thing to note, because that virus, as Secretary Hook said, does go into those facilities from the community and then comes back out into the community. So it's important that we are tracking that as part of our overall effort. Thanks.
Thanks, everybody. Thanks for your questions. Stay safe out there, and we look forward to working with everybody to slow the spread. Thank you.